Hello, my name is Dr. Mel Irvine, and I'm a provider here at Revitalize, located in sunny Southwest Florida. Many of you probably have seen the videos that my colleague, Dr. Mayor Dollar, has put out there on a topic that we are going to be discussing today, and that is the P shot, also known as platelet-rich plasma. Platelet-rich plasma is a therapy that is being used in medicine in quite a few areas. It's been used in orthopedics for a long time, dentistry, it's being used in aesthetics, and now we're using this for erectile dysfunction. We're going to talk a little bit today about erectile dysfunction. It's a much more complicated issue than a circulation issue, and that's where PRP comes into play. So platelet-rich plasma therapy is essentially where we extract all of the healing and growth properties from your blood, we concentrate them, and we re-inject them back into the penile tissue. So essentially what we're doing is we're working on one of the major underlying reasons for erectile dysfunction. In medicine, we're pretty rigid. We define erectile dysfunction as not being able to get and maintain an erection, but it's really a much more complicated issue than that. Men at about the age of 30 or 40 begin to have the beginning signs of one of the more complicated issues to erectile dysfunction, and that is penile tissue atrophy. What is actually beginning to happen is that tissue is beginning to shrink, become fibrotic and hardened. Medications don't really address that issue, which is why they become less and less effective over time. If you think about these medications, oral medications like Viagra, Cialis, Levitra, Stendra, those medications only open up blood vessels, and they're not even selective for erections, which is why the most common side effects to those medications tend to be headache, GI upset, flushing, things of that nature. So then, once those medications become less and less effective, it's not that the man has become immune or tolerant, it's that the tissue has begun to change itself, and we'll get into that a little bit more. Once the oral medications are no longer as effective, men will typically move on to what we call intracavernosal injections, where they're taking an injection of a medication and they're directly injecting the penile shaft. That medication does a couple different things different from the oral medications, because those only open up blood vessels, and they open them up everywhere in the body. The intracavernosal injections open up blood vessels and actually relax the smooth muscle of the penile tissue. So the penis is actually a very unique organ in the body, in that when you think of your muscles, when you're at rest, your muscles are at rest. And when you move, that's when your muscles begin to contract. The penis is the opposite of that. When it is in the flaccid state, it's actually in the contracted state. And it's only when that muscle relaxes that now blood vessels can fill and you get your erection. So when that tissue isn't healthy and it's not very pliable, it doesn't matter what we give you for medications, as far as the PDE5 inhibitors like your Viagra's, Cialis, or the injections. All of those medications begin to lose their effectiveness because the tissue is beginning to shrink and it's becoming fibrotic and hardened. So again, you're not becoming immune to the medications. Other things that affect erectile dysfunction is very multifactorial. It's not just a circulation issue. You're going to have men with different health conditions, what we call comorbidities, diabetes, high blood pressure, cholesterol. So that compounds the issue. You also have, as men age, their testosterone levels begin to decrease. Testosterone is essential for maintaining penile tissue health. It won't restore any of the damage that's occurred to that tissue, but it does help you to maintain your penile tissue health, okay? Because testosterone converts to another substance called DHT, dihydrotestosterone, and that is what's essential to maintain your penile tissue health. Your penile tissue atrophy is essentially equivalent to what we think of as, in women, vaginal atrophy. So penile tissue atrophy is a reality for all men. At some point in their lifetime, they are going to be affected by this. If you think about other issues that might compound it, damage, penile tissue damage. Over the course of a man's lifetime, starting from when he's very young, he actually begins to sustain damage to penile tissue. We think it's invincible because it's on the outside. Why else would it be there if it wasn't? However, if you think about when you're young, contact injuries, sports, wrestling with friends. Younger men tend to have more aggressive intercourse. You can fracture the penis. And there are cases of, young men doing this at early ages, abnormal masturbation techniques. There's a number of reasons that could lead to sustained penile tissue damage that begins to occur over a man's lifetime. So you take all of that, and really it's at about the age of 30 or 40 that men are beginning to have some of those subtle signs, such as they're not waking up in the morning, every morning with their full hard erection. It's getting further and further apart. Erections become far and few between as men age when they wake up in the morning. That is when men really should be coming to seek this therapy, because this addresses that penile tissue atrophy. The goal of platelet-rich plasma therapy is to regrow healthy penile tissue, vasculature, nerves, and it really is the only thing that we have to address that issue. There is shockwave therapy. That's a whole nother topic because there is some, a lot of providers that are starting to use the two therapies together to regrow that dense, healthy penile tissue. So again, now we're talking about growing healthy penile tissue. Well, how do we do that? We do that by injecting the PRP into the penile tissue directly. There are two large chambers that we inject when we do this. There's a third chamber, but we don't inject it because it's much smaller, and that's where the urethra runs. So we really inject these two large chambers called the corpus cavernosum. Now, in this chamber, when we inject the PRP, it begins a process of healing and growing new healthy tissue. This is not an instant gratification process because actually men have sustained damage over decades to this tissue. Younger men are the men that tend to benefit most from a once-a-year injection. They have the benefit of youth, and they don't have that sustained damage that like a 70, 80-year-old man is going to have. There are varying degrees of erectile dysfunction, where you have mild, moderate, and severe. My young guys, like 30, 40 years old, 50 years old, they have typically a mild degree of erectile dysfunction. They will benefit from one injection a year, but even those guys, I tell them that they should be in here for a second injection, typically around 3 months. Do you have to wait 3 months? No. I have different protocols in the office here that address different conditions that men have. So sometimes I do a protocol where men will get anywhere from 3 to 5 injections, 6 to 8 weeks apart, but those are typically men who have a very moderate to severe degree of erectile dysfunction, men who have sustained trauma to the penile tissue, such as surgery or a traumatic accident. So there's different protocols to address different issues in men. We do a lot of peyronies disease, which is plaque located in the penile tissue, typically on that protective lining around those chambers, called the tunica albuginea, is where that plaque begins to form. Peyronies disease, that's a totally different protocol. I will have a video on that to address your needs as well here shortly. But just know that one injection does not address all conditions. This is not a one-size-fits-all. And when we talk about platelet-rich plasma for erectile dysfunction, it is also not an instant gratification process. Your penile tissue did not become this damaged or sustain this damage overnight. It takes time for that tissue to grow back. However, generally by 6 weeks, most men are having subtle signs of that tissue regeneration. It could range and it varies from man to man as far as what they report. Some men will report that they're starting to wake up in the morning with partial erections. There are some men that don't report that. They report that as the weeks go by, they use their medications, they notice their medications are slightly working a little bit better. When you come to our clinic, we do an assessment. We have specific questions that we ask you about your erections so that we can really determine the degree of erectile dysfunction you have, so that we can determine the best course of care and treatment for you. So again, when we talk about platelet-rich plasma, the goal for men is to grow that tissue back to a healthy state. It is not always to come off medication. The goal is to sometimes stay on medication, because once those medications become less effective and men go from oral medications to injections, there's a lot of room to play with strengths on those injectable medications. However, once a man begins to max out, his options after that are limited, and he's moving toward having a penile implant. Our goal here is to never get to that point. We have plenty of men here who have been maxed out on their trimix medications, which are the injections, and we've been able to sustain them on it. And some of those men have actually begun to decrease their dosing on that. But the goal is to stay on those medications sometimes. We're not here to oversell and underpromise a procedure. This is a procedure that actually works to address one of the more main issues and complicated issues when it comes to erectile dysfunction, which is that penile tissue health. Something not a whole lot of people are talking about. So when we talk about erectile dysfunction, again, it's a much more complicated issue than just, hey, I need to take a medication, open up these blood vessels, and get an erection. We have men who have moderate to severe degrees of erectile dysfunction. For those men, typically they're going to need a series of injections. It's going to consist of anywhere from 3 to 5 injections for them to get to the place that they want with their erections, which is everybody wants to get as close to their 100%. We can't promise that you're going to get there, but our goal is to get you back to the point where you're able to go on and have, good penetrative sex. We work on other issues like sensitivity. We have different protocols for that because as men age, sometimes they begin to lose the sensitivity in the penile tissue. And a lot of these protocols that we have here in the office are individualized and tailored to what exactly the goals are for certain patients. The main thing for men to understand is you can't come to the office and expect that you've had a severe degree of erectile dysfunction or you haven't had an erection for many years and then you're going to walk out of here that day with the best erection you've ever had in your life. So that's not how platelet-rich plasma works. There's some information on online that does talk about increasing length and girth, and there's actually truth in that. And this is a part that I think a lot of people don't understand how that is happening. When we talk about an increase in length and girth, and what I tell my patients is I can restore and return to you some of what you have lost, but I cannot give you anything you have never had. So when men are reporting an increase in their length and girth, that is happening because as that tissue gets healthy again, that tissue begins to expand and it becomes healthy and dense, and now you can get a better erection. That is where you are gaining your length and girth. You're getting back some of what you have lost. So that's really beneficial and happens for the man who notices that penile tissue atrophy and that the tissue has begun to change and shrink and is becoming fibrotic and hardened. Stay tuned and check us out online on our YouTube channel. We have a website, revitalizelounge.com, and you can always message us here as well. You can email me if you have any questions. My email is Mel, M-E-L, @sextys, SEXTYS.com. So I get a lot of questions about cost. How much is this going to cost me? Here at Revitalize, for full disclosure, the first injection is about $1,800 for that first injection, and then after that we work with you closely to determine the best course of treatment and maintenance program that's going to meet your individual needs and goals. Remember, this is not a one-size-fits-all procedure, and the number of treatments is going to vary depending on the degree of erectile dysfunction that you have, and it is affected by a lot of the factors that we had discussed earlier in the video. So give us a call today if you're interested in learning more about what's available for you, and thank you for listening.